Do we ever treat somebody for diabetes per se? Not necessarily, but it's always a complicating factor with the other things that we're working with. Now, there are things that you can learn and kind of learn today about diabetes, of what you need to do, and kind of watch yourself. I worked in rural Missouri for several years, and I would say that 90% of every person that I worked with in rural Missouri had diabetes. So you kind of, obviously a lot of it has to do with lifestyle and diet and things of that nature. But as it says here, diabetes is a disease that affects many older adults. And what it is basically your blood glucose is too high, your blood sugar is too high. And we can take steps to delay or prevent it through type 2 diabetes, and I'll get into the two different types of diabetes. And but what we wanted, the most common form is type 2, and then there's type 1 as well. So what happens is our body, the food we eat, our body turns it into sugar. Okay, it turns it into sugar, which becomes the energy that we use to do our daily function tasks. To use the glucose as energy, our body needs insulin, and that's a hormone that basically helps glucose, the sugar, get into the cells so the body can burn it and use it. When you have diabetes, your body, if you have type 1 diabetes, your body doesn't make insulin at all. If you have type 2, it either is not making it correctly or it's not using it correctly. And which causes too much sugar within the blood, which can cause other health problems over time. As I said, the two different type of diabetes, you have type 1 diabetes and you have type 2 diabetes. Type 1, basically your body does not make insulin. Typically, you're going to find this in in children and young adults when they're first diagnosed with this. And you basically have it for life. You have to learn to live with diabetes at that point. Type 2 is probably the most common form of diabetes, and it's when your body, it's not using it or making, if it's not making it or using it well. It occurs often in middle age and older adults, and the risk is 2 times higher if you're overweight, if you're inactive, or if you have a family history of diabetes. Some of the signs and symptoms of diabetes, and this is going to go with type 2, is going to feeling sluggish and tired. You have increased hunger, increased thirst, losing weight without trying. Hey, maybe I'll take that. Frequent urination, blurry vision, numbness or tinglings in the hands and feet, dry skin, frequent unresolved infections, and sores that heal slowly. And as we kind of go through, you're going to find out these are the problems with diabetes that if you have other ailments that occur. Effects of diabetes on other body functions, kidney disease, vision loss, heart disease, neuropathy, stroke, and other complications. Early in my career, I learned when I was talking about having people with diabetes. This is probably in the late 90s, early 2000. Almost every person I worked with that had a bypass surgery back then, when they would cut you all the way up. Several people with diabetes that never healed. That scar never healed, and typically you'll find with the extremities, we'll get into it here in a minute, with the extremities and neuropathy, you tend to have more amputations with diabetes because the loss of function, the loss of the blood flow, loss of function with the nerves on those far extremities. You're a higher rate for infection just because you're not healing fast. Medications used to treat and manage, this is for type 1 diabetes. Obviously insulin, that insulin is going to replace what your body cannot make. It comes in short acting, long acting, or a combination of both. It's given by injection in several forms. So And then there's also the amnion liminetic drug, which is what you would give yourself before meals, an injectable. And this delays the stomach emptying time to allow the glycogen to work, and for also help with the lower your blood sugars during your meals. And it reduces appetite. These are the different medications used for type 2. You can see there's a long list of them. I don't know if I can pronounce 4 of those words up there, so I won't even try. But as you can see, they're all some form of being able to, like the second one, help break down starchy foods and table sugar, which your body can't do. So it's like a form of insulin. And the next one decreases how much sugar the liver makes. Yeah, great stuff. And then I do know, I'm trying to remember, like with pre-diabetes, which one of those is the medication like you would get for pre-diabetes. I'm not 100%. I know the name of the drugs, but I don't know when they talk about the type. So, long-term complications with diabetes. So the first one is peripheral neuropathy. This is to me one of the biggest issues, where you have a loss of sensation in the extremities. You're going to find it in your hands. You'll have you ever sit long enough or sit on the commode long enough and your feet fall asleep? Yeah. That tingling and how it hurts. Well, that's basically what neuropathy is, but that can last ongoing, on days. So it can be very painful. Obviously, different phases of it, to where you have the kind of the stinging, the prickling feeling, almost like stabbing. And then it gets to the point where there's no feeling at all and it's totally numb, and that's the scary part. That's when you have to be hyper vigilant with your feet and your hands. Feet. I mean, our feet are our base of support. It's where we walk, we stand. Everything we do is on our feet. I like to, if everybody see Forrest Gump. Yeah. And there was a scene where Lieutenant Dan told Bubba and Forrest, when they first got there, protect your feet, protect your feet. And it is so huge. I've seen so many people with, just a matter of going to the podiatrist, getting your nails trimmed, and maybe they have somebody else trim it, clip the side of your toe, becomes infected, doesn't heal because of the neuropathy, then you lose a toe, And then typically, if it just keeps going up, after you lose a toe, then you end up losing the foot, and so on and so forth. Another issue is diabetic retinopathy, and this is there's an increased pressure in the blood vessels, so you see black spots, blurry vision. A lot of people run into this before they'll have any other symptoms, and so it takes a while to kind of figure out what is going on. The nephropathy is the deterioration of the kidney functions. So this is another important thing, because our kidneys, filter all the blood, and without that, then possibly risk of having to go on dialysis. Chemical imbalances. So this could, I've watched. This is a highly thing that I have to watch for when I'm treating somebody with, say, a fractured hip. If they have diabetes, making sure that their blood sugars are in check and staying fine, because of these imbalances. When they have dizziness, you get clammy. Maybe this is when falls occur. Skin conditions. Skin may be more susceptible to bacterial and fungal infections. Once again, along with the neuropathy, it's because we're not getting the blood to flow to as far as we need it to go. And some dietary tips to focus on. You want to maintain a reasonable weight. You want to eat to maintain normal glucose levels. And so focus on the non-starchy vegetables, fruits, lean proteins, whole grains, and unsweetened beverages. Here, I do like, how much am I supposed to eat? And I do like when you being able to use your hand as a guide. It's probably hard to see, but I'll kind of go through it with you guys. So 3 ounces of meat, fish or poultry, will basically be similar to the size of your palm. Okay? 1 ounce of meat or cheese would be your thumb from the base to the tip. 1 cup or 1 medium fruit would actually be the size of your fist. Now, I think I may have a bigger fist than some of you guys, so I'll go with my portions. So. 1 to 2 ounces of nuts, pretzels, basically would be a cup in your hand. So that's about 1 to 2 ounces. And then your thumb from the tip, we'll call this your I don't know, it's called your DIP, but from that first joint to the tip, that is going to be 1 tablespoon. That looks pretty close. And then 1 teaspoon is like your index finger, the tip to the top. So about that size. I think it's pretty close. So. Physical activity as a treatment approach for diabetes. So exercise. And, it doesn't necessarily mean that you have to, go and lift weights and go and run and do boot camps and things of that nature. Just being cognizant of even if you've been just sitting for 30 minutes, getting up and moving. But exercise, it does lower blood sugar levels. When you get up and you get moving, you get the blood flowing through your body. First of all, that's going to help with neuropathy, help with any of the tingling that you may have. It's also going to move the blood sugar into the cells, like I said, which will help you use that for energy. I like to look at life on a cellular level, such as, our body is made up of billions of cells, and how we treat those cells is how our body is going to, react to it through diabetes or whatever it may not be. And I always say keep those cells hydrated by drinking your water, so you're not drying out. Exercise also increases your sensitivity to the insulin, so you're not going to need as much. The body needs less insulin to transport the sugar to our cells. You want to aim for at least 30 minutes of aerobic exercise daily, just going out for a brisk walk, or 150 minutes of moderate activity, and get up. So like I said, get up and move if you've been sitting for 30 minutes or more. Exercise, it's going to lower your blood pressure. It's going to burn those extra calories as well, to kind of help with getting your weight down. And it's going to improve your mood. It always does. Always improves your mood and help with falls and also memory. So, how to exercise safely with diabetes, and it's all about making sure you have a plan. You want to talk with your doctor, see what your limitations are if you have any. And you also want to be able to, with this first part where it's going over the blood glucose, you want to, work with the healthcare team to determine what your blood sugar level should be. Plan the best time of day to exercise. For me, my best time is first thing in the morning. It just works best for me. Makes my day smooth too once you get it out of the way. And then in some instances, you're going to check your blood glucose before, during, and after exercise. That's more of what your doctor would probably want to see how your body responds to the exercise. Critical foot care. You want to check and wash your feet daily. Smooth any corns and calluses and trim nails. This is where I think it's every 6 months, I believe, you can go see your what are they called? Your foot doctor. Thank you, the podiatrist. Yes, you can see your podiatrist to have them trim your nails. I don't know if it's every 3 months or is it every 3 months? Yeah, good.
60. It's 60. 60 days.
60 days?
60 days,
Yeah.
yeah.
Beautiful, even better.
60.
Medicare, right.
Okay.
Right at 60.
Yeah. I know trying to get specialty doctors to come into like facilities it's like pulling hair. They just won't come. But I do know podiatrists are one that will. You know, they have it set up through Medicare. And then wear socks along with comfortable and supportive shoes. The other thing you're going to have to be aware of is if you do have the numbness and you can't feel, you know, if you're cooking, touching hot plates or being around the stove, you got to be careful because it's just easy to burn yourself, easy to get scratches, easy to get cuts because you just don't feel it. Same with the feet. If you don't feel your feet and you're walking around all day, making sure you don't have blisters, making sure you don't, if we all do it, come and we kick in the morning, make sure you check your toe that you don't, your nail's not coming off. I mean, it sounds drastic, but these are things that can happen and you don't even realize.
Question?
Yeah.
Lower left. Check your blood glucose before, during, and after exercise. Is there a target you're looking for?
That would be more coming from your doctor. Typically, mine was, when I was doing mine, they wanted it under 80, but I never had to check before, during, and after. I always checked my fasting when I first woke up in the morning, and that's all I had to do. So it all depends on if that's kind of extreme, before, during, and after, but that would come from your doctor to do that. So mine was always the first thing in the morning when I woke up. So here, exercises to add to your routine: walking briskly, climbing the stairs, swimming or water aerobics, dancing. Any dancers? Stationary bicycle exercise classes, the use of weights, using resistant bands, the machines, stretching exercises, and yoga. And I believe every single one of those are provided here at Mason Point, at in some way or another. So I'm a huge proponent. Obviously, the walking is good and getting the heart rate up, but these two down here, I feel are probably the most important that you guys can do on a regular basis. Take diabetes out of the question and everything. Just as we get older, our muscles tend to, we get weaker, they get smaller, and our bones, everything just, start to curl. All these things start to happen. So stretching is just vital important, especially even if with neuropathy, because once you lose the sensation in your feet, then you start to walk more kind of like flat-footed, because you don't have the ability to do a toe or a heel to toe. So you start to walk more like Frankenstein for your safety, And so what happens with that is now you're not doing the heel to toe, so now your calves get tight, and then your calves get tight, and then your quads, your thighs will get tight, and your ham, and it just works its way up. Next thing you know, your whole body, you're going like this. Somebody, if the startles you, most people's response can be so, but if your body's tight, that's going to increase your chances of falling.
So assume you just have chair yoga because most of us aren't flexible enough for real yoga. Is that?
Well, if you could do real yoga, yeah.
Yeah. Okay. I was just checking.
It's pretty hard stuff. You ever tried it?
Yoga?
Yeah.
No, I'm a Tai Chi person.
Yeah? Hey, yoga's something else. I'll tell you what. Funny how and like it's invigorating and the stretching, but it's also taxing on your body. And this is a way that therapy can work with somebody with diabetes. Obviously, balance and fall prevention. That should be our number one thing that we do with everybody we see. We're looking at balance and fall prevention. Going to show you how you can actually incorporate all the moderate and the aerobic exercise in a daily routine. Well, obviously in therapy, then we would, be able to do 2 to 3 days, 4 days, 5 days, whatever of strength training. Be able to educate on diabetic foot care and footwear. And you'll find some therapists are better at that than others. The use of adaptive equipment. I love adaptive equipment. Things that are kind of maybe being able to put your shoes and socks on, or being able not having to bend over to reach by using a reacher, things of that nature, or in your bathroom having an elevated seat, or maybe something in your bed to kind of help with a bed rail or a temporary type of bed rail. And then also the other thing is we're going to do is we'll assess the environment, like in your house, and make recommendations. Like, you do better if you move this rug, or let's move the couch over a little bit so maybe you're squeezing by to get through. And instead of adapting you to the environment, we would like to adapt the environment to you. In occupational therapy. This is a good one. Obviously the medication taking your medications is a big thing. That's another thing. If working in this setting, you don't see it as much because medications provided by nurses or whatnot. Now you guys have to do your own medication management, and I've done home health in my time where I've come out and they'll have like 25 bottles of pills sitting out, and they're just kind of go through them daily to figure out which one to take, and it's just too much. So we can come up with techniques of using different organizers to help set it up. Using obviously like pen and paper, or using a computer program to kind of help make sure you're getting your what medications you're putting in your organizer. Set it up for your week, or I guess in some cases you can set it up for even a month. I know there are some pharmacies that are now coming out with here in the near future where your medications can come to you how you would take it on the instead of each bottle, they would come to you the way you would take it each day, or morning, afternoon, and night. Just kind of neat. I like that. And also instruct in the use of low vision devices as needed. There's a lot of resources in St. Louis that we could use to help with low vision. Just having low vision. I mean, most of us, we start to lose our vision as we get older, anyways. But if you have that diabetic retinopathy, everything's blurry. You don't have to. Everything doesn't have to stop now. There's ways to get around that. We can use big red, put big red buttons like in the kitchen, or big red handles so you can see them easier. Things of that nature. There's just a copious amount of resources out there that we could use to, like I said, adapt the environment to you. Also incorporate protective techniques. So what that's going in, teaching you how to use your walker, like if your neuropathy is really bad, teaching you how to get in and get out of the bathtub, things of that nature. Here where it talks about heat and cold in sharp objects, just being hyper vigilant to those things is so important. And that concludes the presentation. A very simple, quick presentation. This is just something my company has. Yeah. Does anybody have any questions?
Yeah, what does the word myelitis mean?
Say that again.
What does the word myelitis mean?
Mellitus.
This illness is called diabetes mellitus.
That's you've asked me a question now. I haven't taken my disease process class in like 30 years.
He's saying diabetes mellitus.
Yeah.
Yeah.
Am I pronouncing it wrong?
I call it mellitus, mellitus, yeah.
It's mellitus.
Let's see what it is.
I guess I could Google it myself.
I got it. Let's do it.
Latin siphon, to pass through. Greek word for diabetes. Oh, mellitus means sweet.
It does mean sweet.
Uh,
Yep. Sugar.
In my experience, you mentioned working in rural areas. In my experience as a lawyer dealing with people who came from rural areas, it was always referred to as sugar diabetes.
Yes, 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 yes. Absolutely, absolutely. I gave you a little handout. There's a questionnaire on there. You feel free to fill it out, and then there's some tips on the front page. I left my cards there too. If you guys ever have any questions, if there's something that maybe if you guys are if you have diabetes or know somebody with diabetes, or you guys any issues having problems with balance or pain, and you want to call me or see if there's something we can do in therapy, my card's there. I'm here every day. So any other questions?
I'm shocked that doctors did not diagnose diabetes as a cause for my imbalance, which started years ago.
Yeah.
We treated a symptom before we did identify the cause. Can you believe that?
Yes, I can.
Only
It's our healthcare
7
system.
years ago was I identified with diabetes.
Yeah.
And I've never really gotten into sufficient education on diabetes.
Sure.
So I probably want to work with you.
Okay.
That's interesting.
Yeah. So I don't know. It's I know. I mean, this is a very quick kind of presentation going over it, but diabetes is it's a killer. It's a killer out there, and but there's something if you do have, you can learn to live with, and you can live a very healthy, successful life. You just have to become vigilant, and we should all become vigilant of our care, of our health, anyways. So,
How sensitive, this wasn't mentioned, but it's very much on our minds. Today, it's been reported, we're going to reach 99 degrees right here in St. Louis. How sensitive should a person that has both diabetes and imbalance be to those conditions? Normal?
I would think with diabetes or not, you need to be once again hyper vigilant. I mean, going outside if in this type of weather. First of all, if you have any breathing issues, that can add on to it as well. There was a doctor on this morning said, do not go outside. Just don't go outside today. Unfortunately, some of us we have to, but and some of us have to work outside as well. But once again, making sure you're staying hydrated. Just drink plenty of fluids. So.
Okay, something else you did not mention was the A1C test. Could you talk about that a little bit?
So what if I have a little, I'm not an expert on that by any means, but if I recall that, I'm trying to remember like when I did where you're supposed to hit, and is it 8? Anybody know?
6.
6?
6 and above is diabetes.
6 and above is diabetes. Yeah. I don't really know much about it there, Ms. Schreiber. Everybody okay?
So you would provide either class or one-on-one instruction as needed to people that have never had instruction on diabetes?
So not necessarily how your education for diabetes should come from the team itself, like from your doctor, probably your primary care, and then what's the other, if you have maybe a nephrologist, endocrinologist, yeah. And then what we do is we're going to work together with that doctor and you, making sure that you're being vigilant of your foot care, making sure that your balance is good. If your balance is off from neuropathy, we're going to show you some strategies on how to keep that balance, what you need to do in different situations, as you're getting up, through the day to just do your normal activities of daily living. That's where we're going to come into play with that. Okay. Yeah.
If I could do a commercial, we do have a diabetes support group that meets here
Yeah,
Excellent.
once a month. It's
Right.
the fourth Thursday at 7 p.m. at night.
oh, it is fourth,
Fourth, yeah, just
Not
called David
Thursday.
Bond.
oh, it's fourth. Al, Dave, my apology, I know you've,
And I'll be perfectly honest with you. Like, you can have a million professionals come in and tell you or read the books on everything, but support groups are probably one of the best ways, because you're dealing with people who are living with it and how they live their lives. And I think support groups like that are great, phenomenal. Like, even in my profession, you know, all my textbooks and all the training, you could just pretty much gives you a basis. Where I learn most of the things that I do is from you guys. You know, when I'm working with somebody, well, this is, you know, they tell me, well, this is how I open a jar when my hand hurts. This is how I do X, Y, Z. And so sometimes it may be unsafe, and we can give recommendations on things that make it easier. A lot of times I'm like, okay, let me put that in my back pocket, because that's another thing I can teach somebody else. So. All right. Well, that concludes it.
Thank you.
So if you have any questions, please, my card's there. That's my direct line. It goes directly to me. So, okay.
Thank you.
All right. You're welcome.
Did you learn